Hi, I'm Shabir Imbersafter. I'm the Executive Director of the Partnership for Safe Medicines. If the 90-second intro to the Drug Supply Chain Security Act wasn't enough information for you and you want just a little bit more, that's what I'm going to do. I've actually spent a lot of time educating pharmacists and other dispensers about DSCSA and their obligations, and I've taken a small version of that course and provided here for you today. So just what a policymaker, just what a staffer needs to know about the DSCSA so you can be smart as you're working in and around healthcare policy. So I'm going to take a moment, turn off the camera, and then we'll go through this presentation. All right, so the Partnership for Safe Medicines, if you did not know, is a 20-year-old this year, not-for-profit. We study the drug supply chain and counterfeits in America. Our membership is only other trade associations and not-for-profits. We don't allow any corporate participation. So you'll see, we have trade associations that represent pharmacies and wholesalers and manufacturers in our group, but the actual for-profit corporations are not allowed. And we're super excited. We feel like we've got a real cross-section of the pharmaceutical supply chain as part of our membership. And we actually publish every single week. You can find our stuff on all the social media. We've done lots of really interesting reports on the spread of counterfeits in the US, fake Adderall, fake pills sold through social media and pill presses. There's a lot more to us than just the Drug Supply Chain Security Act. So the DSCSA, when it was originally created, was actually part of the Drug Quality and Security Act. And that piece of legislation passed back in 2013. And it really was driven by the fact that we had no tracking system that would allow an investigator after the fact, when discovering a counterfeit, to be able to say, who handled this? And if someone said, well, these are the people who handled it, there was no way to know if they were lying, which is a really big problem when you're doing an investigation. When anyone you talk to may in fact be a criminal who is not telling you the truth. And the idea that our drug supply, which, if it fails, can cause people real medical harm, runs on trust without any verification, was a problem. And it had been shown to be a problem with a number of counterfeit outbreaks. So they passed the law in 2013, and then they spent the last 9 years, this is year 10, implementing it. And you don't actually know this, but if you look at the saleable package of medicine, which sometimes is a single bottle for you, and sometimes is a larger 500 count bottle, but the saleable package has serialization on it unless it's one of the special products that is not required to be serialized. And that's because the manufacturers had to do, their parts of compliance quite a long time ago. Let's talk about what's not part of the DSCSA. So people talk about blockchain all the time. Blockchain is a good protocol for peers who want to transact things without a central authority, but it's not required for trust in a system if you have a trustable central authority. And in fact, there's no blockchain in the DSCSA. There's also no RFID tags, no micro manufacturing items, there's no invisible ink, there's no scratch off to verify. There's a lot of technologies that are out there that are pretty interesting, but are just not a part of the Drug Supply Chain Security Act. So what is it really? It's really just a combination of technology standards and legal obligations. And it covers pretty much everybody who changes ownership of medicine from the factory floor to the dispenser. So it runs to the pharmacy shelf, but doesn't really include patients. And there's a number of reasons for that. The last mile between a pharmacy shelf and a patient often has a significant change of packaging, and that would be extremely onerous to carry forth the serial number information. So it would also require some change of behavior from patients, and so they did not decide to extend it to patients as a result, although some patients do see their serial numbers. So what are the tech standards? Well, the labeling standards are one. All labels had to be re-architected to account for new information. And then there's data exchange standards. There's transaction information that has to be passed back and forth between people as medicine changes ownership. And what is the electronic format they use is a big part of the standards. Um, the legal obligations are pretty straightforward, and they're not anything you wouldn't expect. You're only supposed to buy and sell medicine from licensed trading partners. And so the FDA has a document that tells you what that is and also sets some standards for what licensing standards should be. Because every state, if you didn't know this, licenses wholesalers, pharmacies, pharmacists, and even manufacturers to some extent if they find themselves in the distributor business. And so, you can look at this document from the FDA that is some guidance about how to identify trading partners. But generally, if they've got a state license to do what you want to do with them, they're probably safe. Another legal obligation that is part of the DSCSA is only to trade serialized product, and that's in effect now. Now, that doesn't mean only trade product with serial numbers, because not every piece of medical product you handle will have serial numbers. And here's an example. This is the shingles vaccine, which I actually got. And when I got it, I took a picture of it. It's got a 2D barcode on it, but that's actually not the serial number barcode. That's actually for more information about the vaccine. That vaccine is packaged. Its saleable package has a number of vials. I think it's probably 8 or 10 that it's shipped with, and that package of 8 vials plus attendant objects and tools are all serialized as one. So it is not the case that every single thing you handle will have a scannable serial number and barcode. Only the smallest saleable package will have that. There's the requirements are different for what kind of healthcare worker you are at the end of the chain. If you're a pharmacist and you dispense medicine, it's different than if you're a physician and you dispense medicine. But for a pharmacist, you only trade with authorized trading partners who are licensed. You only trade products that have identifiers unless they have an exception to that in the law. You have to participate in tracing of products when it's required, meaning you also have to store all of that data. You have to respond to requests for information, and when you suspect that some product may be illegitimate, you have to investigate it, quarantine, and verify it. So these are obligations that you have to do. So here's an example of a drug I made up called Confoundium to give you a sense of what the label would look like, and then here's a closer look at it. Almost all medicine has had for a number of years a lot and expiration number. The lot is the production lot, the manufacturing lot. So all the medicine made in a batch, for example, would have the same lot number, and it would expire based upon a number of scientific factors about the medicine. But we have 2 new numbers on every label. One is a GTIN, and that's a unique identifier that identifies the manufacturer, which might include a compounder or a repackager, and a serial number, which is unique to that smallest saleable package. And whatever the smallest saleable package is what gets serialized. If you only sell a medicine that your company makes in a 500 count bottle, then that's the smallest saleable package, and your 500 count bottle gets 1 serial number per bottle. So there's a couple of exceptions in the law of things that don't have to be serialized. Blood or blood components, radioactive drugs or radioactive biologic products, imaging drugs, certain IV products, medical gas, certain homeopathic drugs, or drugs compounded in a certain way. So this isn't every single last thing, and I think that that's really important. Another thing I mentioned before, that you have to respond for request to information, and this is actually in the law. You don't actually have to go to court and get a subpoena to get this. If you're a state or federal official and you're investigating a suspect or illegitimate product, you can actually demand and get within 1 to 2 business days, the transaction history of medical products that have been serialized. So some people ask, how does the system really work if it depends upon the judgment of someone who has to decide whether or not a product is suspicious. Well, the FDA's got a handout for that for you, and this handout has outlined all the things that you might use as either a wholesaler or a dispenser to determine whether or not a product is suspiciously illegitimate. And they're all things that a cautious, risk-averse human being might suspect. It's too cheap to really be true, right? That Gucci bag that's $50 on Canal Street, New York City, that retails for $2,000. Well, that's too cheap to be true, and so would an HIV medicine that's $50 instead of $800. If it's coming from a small, obscure wholesaler, or if it's been traveling around the country through different wholesalers in a weird way, if it's in poor condition, if it comes warm and it's supposed to be refrigerated, if you think that maybe at some point in the transaction history it went through someone that makes you think it might be diverted. Maybe you look at the transaction history and the person named 3 steps behind you does not have a pharmacy license in the state they're supposed to. Um, and there's a lot of other reasons in there, but you can use this to take a look and figure out whether or not it should be suspicious. And then what do you do, right? Well, suspect product is any product you suspect may be illegitimate. And what you do is you've got to quarantine it and then validate its transaction history. And it's not that hard. I'll do one here in a minute. But basically it involves checking every step that the person who sold it to you told you that it took, and everybody who owned it. So let's do an example. Let's say you get an offer like this, and this is a made-up offer, but I guarantee you that people get stuff like this, where they are offering, an HIV medicine, and it's, cheaper than it should be, and they will offer a DSCSA compliant transaction log. I asked pharmacists to send me these because these are often evidence of fraud. And let's take an example for an HIV medicine, that's made by Gilead Sciences and then sold to AmerisourceBergen and then to some other wholesaler, and then some other wholesaler who sells it to you. This might be the transaction log that you're handed. And that transaction log is supposed to show you every entity along the way. Well, the first thing that you would check if you were checking to see if this was legit or not is you'd look and see whether or not the first sale went to an entity that was one of Gilead Sciences' restricted first sale entities. Gilead doesn't just sell their medicine to anybody. They sell it specifically to individuals on a short list of wholesalers in this country, and then from there on out. So if you were to find it going to them and then it went from there elsewhere, and that first sale is not one of the people on their website that they sell their first sale to, then that was suspicious. A pharmacist in Texas actually had this experience where he got an offer just like the one I showed you, and he was checking the transaction log and he saw that it went through AmerisourceBergen, who was also his wholesaler, and it was cheaper. And he'd been told that he and his fellow pharmacists who were banding together for volume discounts were getting the best price. So he reached out to AmerisourceBergen and said, "Is this really true? Because if so, you're not giving us the best price." And AmerisourceBergen said, "Well, no, that's never been in our warehouse. That's actually not a medicine that we handled." And so he knew from looking at it that this was fake. And so he actually was able to identify it as medicine that was not safe for patients. He returned it to the Joe's Meds wholesaler. That was probably not the right thing to do. It should have been quarantined. And he actually ended up scratching the tip of the iceberg of a much larger $250 million crime. You can learn about that crime if you scan this QR code and go to our report about it, but it's actually still ongoing. And there's a lot of people who are going to end up going to jail and or paying enormous fines as a result of this discovery. Anyone who's a federal or state official can make requests to manufacturers, wholesalers, repackagers, and dispensers for traceable product, right? It's actually something that is written into the law. Something else that's worth talking about is recalls. You know, before the DSCSA, if you wanted to recall medicine, the only way to identify medicine bottles to recall was by their lot or expiration number. And those are large collections. Those represent large volumes of medicine, sometimes tens or even hundreds of thousands of bottles. Now, if you have to recall medicine, perhaps because you are worried about either a manufacturing error or because you've seen some medicine go through a counterfeiter, and they've been falsifying labels, you have a lot fewer bottles of medicine to have to recall, right? Because now you can recall individual bottles as opposed to whole lots of medicine. And the problem with the way that we used to do it is that recalls took so much good medicine off the market that you ended up creating shortages of medicine for patients, and that in itself is a problem. Now you no longer have to do that. If you see an individual who's trafficked in medicine that you suspect, he just printed up labels and made up, you can just recall the serial numbers that are on those labels that you found or that he made, and not take good medicine out of the medicine cabinets of tens of thousands of patients nationwide. There are some criminal penalties for violating the DSCSA. If you're an aficionado of the Food, Drug, and Cosmetic Act, you know about the multi-page prohibited acts section of the FD&C, and violations of that for your first offense is a year, $1,000, and if you are doing it with intent to defraud or mislead, and if you do it multiple times, the penalties go up. These are not usually the only trouble you have. If you're a healthcare professional with a license and you violate the Food, Drug, and Cosmetic Act, you're probably getting a state fine and a sanction from your licensing board, be it your medical board or your state board of pharmacy if you're a pharmacist. There's a couple of really great places to look for more information about the DSCSA besides the Partnership for Safe Medicines at safemedicines.org. You can check out this resource that a number of major pharmacy organizations collaborated on at dscsa.pharmacy. It's on the web. You can also check out this book that is an annotated version of the law by Dirk Rogers that you can get on Kindle Unlimited, but you can also buy in the store. And you can also, I would recommend that if you want to get a really good flavor into a really important historical counterfeiting event in the United States, that you read Dangerous Doses by Catherine Eban, which is one of the first real good profiles of a counterfeit crime that was a nationwide crime here in the United States. So lastly, if you have any questions, please reach out to me at the Partnership for Safe Medicines. We actually do briefings for congressional offices all year long on the counterfeit problem in the U.S., and it covers both the illegitimate drug supply, which is all of the pills, fake opioids made with fentanyl that you know about, as well as things like fake blood thinners that come in through Mexico, or through the small package mail that we're having a problem with right now. And of course, look for us on social media. Around this video, you're going to find lots of other briefing topics, both in the 2 and 15-minute version around the counterfeit medicine area. And please join us on February 28th, 2023 for our Hill briefing. We'll have some really exciting folks there talking about the current state of counterfeit drugs and counterfeit drug policy in Congress. Thanks, and have a great day.